Voluntary Health Association of Meghalaya, VHAMS, it is an organization that focuses on improving the health and well-being of the communities of Meghalaya. It aims on enhancing access to healthcare facilities, especially in the rural and marginalized sections of community. VHAMs provide free access to services, testings on HIV, AIDS, and also on medical facilities. It aims to targets on the reproductive child, women, HIV, AIDS, and adolescent health, substance use disorders such as drugs, and also community health of the people. Now we'll discuss on the questions and interviews for the agency staff.
Can you please introduce yourself, sir?
Okay, my name is vhamegh. I'm working as a program manager with the Voluntary Health Association of Meghalaya under the project name called Targeted Prevention Project. It's a project supported by Meghalaya AIDS Control Society, working on behalf of injecting drug users. So, as a project, we provide services like needle syringe exchange program, whereby under this project under this program we give clean needle syringes to those clients who are still using drugs, because we know that we can't stop a person from using drugs. So in order for them to stop the rate of to decrease the rate of infection and bloodborne diseases, we give them new syringes. And we also have this opiate substitution therapy, whereby those clients who are willing to give up drugs, we give them these medication, which is government prescribed medication, after seeing the doctor and the counselor, and they'll prescribe according to the dosage. And we also have the counseling session, whereby any clients who come here, they have to go through the counseling session first before being enrolled in the program. Then we have the regular medical checkup, and testing is one of the very important thing in our program, whereby we make sure that each and every one of the clients are being tested for HIV, STI, which is sexually transmitted infection. And now with the higher rate of hepatitis B and C, we also tested hepatitis B and C.
Okay, sir, I have a few questions for you.
Okay.
What are the responsibilities and roles as a program manager?
My role and responsibility as a program manager is that I have to overlook at the overall activity of this project, right from the administration, right from the advocacy and networking with different stakeholders. Then I have to look at the activities that being carried out by the field workers, like outreach worker, program peer educators, and even with the medical checkup with together with the nurses and the doctor. We used to have a consultation. Those are the things that I'm overall in charge of all the program. So whatever problem that they are facing, they come and address it to me, and then the problem that I can solve here in the office, we solve. Otherwise, those who need help from different high level authority, then we go and meet them and all. Those are the things and the roles and responsibility.
Okay, sir. What are the goals of the organization?
Our goal as an organization, if you look at our website, is to make health a reality. So because our organization is focusing on health, to make health a reality to all community people, whereby we take the health as one of the most important basic human rights. So in the community level, we work with pregnant mothers, children, and we make sure that they fully immunize themselves, their child, and they come for regular medical checkup and all. So then we organize health camp in some of the villages, in the localities and all. So those are the goals and objective of the organization.
What are the services you provide in your agency?
Actually, the services I've already spoken right from the start. Those are the needle syringe exchange program, the opiate substitution therapy, the counseling, and the regular medical checkup that we conducted, and the field work, extensive field work being carried out by the peer educators together with the outreach workers to meet and talk with the clients and providing them IEC, BCC about the harms of drugs and what to do. Those are the those are the services that we provide.
Okay, sir. Thank you so much for your time.
Welcome.
Good afternoon, ma'am. Loma pin batai phangna di ba ki kamram jong pi kumi awi shoka hakani organization.
Okay, thank you. Good afternoon to your student. My name is Violet Kharpunga, and shortly call me Miss Violet. The ngatrai kumi outreach worker hapo organization jong Voluntary Health Association of Meghalaya, FIDU, Female Injecting Drugs User. So kakamram jongi kum ki outreach worker ne kakam kalong bangila ban mobilize ngila by identify ki IDU that is female ki kan thai ki ba ngop how new jindi jong ki drugs de kakamram jongi kalong bangi devan kendu eki badru bangila ban ai ka jingerap na banta jong ki ken hake eki kaliang ro ada kal de nawang nitre ba ka health so ka jimu jongi hakane ka kamru kum outreach worker ngi devan pen Shillong kot kia banyarap iki hakaliang ka kot kia te ka kamlam jungi kum yaudi choka hakani ka feel kalong bangin identify ki claim and then bangin jo register iki and then bangila ban jo ban eye services iki kum ki needle syringe exchange program ki RMC regular medical checkup when it comes to counseling te kum OST program bangi don menta opiate substitution treatment te hadina tu pa ngida ni ki pamphlets kumbok ong IEC material where kanika pamphlets but em kayarap iki hakata kawai kar kom em bakila ban yo more information na maba ting dang ni kren ki klet no so da ka ba ai gini ki IEC material they will come to know more, they will know more, they will get to know more information can shabhang kanika organization but can you more information about the health ke kam ke ka ba kila ban yo chingerap ke kani ka chingpang ka threat kumno kalong kumno tingi ji alam test kilo every 6 months them ting fi khot ikiklan belit test 6 months so they won't know what's ka test you kata dai ne te mangi ban educate them in such a way bakila man so thu ya kata ka ICTC kamo integrated counseling testing center bakila ban test hangni kani ka test par kadai for both HIV and STI HIV plastic human immunodeficiency and STI kada sexually transmitted infection so ye kini ki client ki bangla register hane ngialam test ki hapo either civil or else mobile STC van tingile ki every 6 months and plus ngile ki hapo IC ru hane hapo drop in center kabangile ya ka community based screening kataro kalau kum ICTC pa tamakani ka CBS community based screening kadai kabangi test kadai ka tangshu screen tambala dala body positive kono kalan pa ni habila meke for civil hospital and this is how kadai ka kam kaba mangi ki outreach worker ngile along with the peer educator
Te kumno pi penyadai ni ate bat ki brio ban penbiang ya ta jingdon kam jongki.
Second question kalau kacing ada mean the connection the bond right ka bond jongi ba ki klein kalong ba first of all kalong bangi but ki contain ama you know female te kilong very vulnerable very sensitive fi bakla kren ru lap het no dinam so kata em kalong bangi de bond choi kata ka relationship first of all em kini ki klein ki bangi register kim juwan directly through us kill it through the peer educator the peer educator part ki identify ki after that dala kundu ki peer educator then ke sakhot ingi then mangi pang sakrani ki ken after 4 time 5 time ni dan counseling but ki then only can long open bangi otherwise on the first day dangi kundu umturi they will not be open with us kan nama when you deal with females you should know how to talk so at the same time nama ba ting the fikaran he ki do de maki kan kanan de no they will not come for help so what do we do First of all, we build the bond relationship there. It should come first from the peer educator to the client, and then the client to the outreach worker. Kim ju one direction ni, bagi peer educator. Then peer educator, we got to reach them. Okay, kata kebon kalomba, hadin dalai kendu lang koni kulung, dan saya kot lampat baru, ingin kendu kini. Ye counselor, then the counselor will do the rest according to her plan.
Ki kamram jompi ko outreach worker hakani organization.
Kamram ke janga kum outreach worker ni ke bangyong shortcut URW kalong ba ni ha ban I service ya ki client ke bangyong mo ki HRG ni ya ki naman kum magalom lesman idan atli ki project ke ni tray kata ka TI target intervention bat ka opiate substitution therapy OST. Thì kini ki TI IDU ki khana ki badangop ha ki ding rocks ka joti ni ha an ice service ki kum ku syringe nang tang dan ru ki service ka ni ai kum ka testing ka bangile ring baki mobile ban dan ki mobile ICTC namun tano and then dan ru ki ICTC kum ki city hospital ni sebab tu te ni ha an eye testing ki khana bang kin yo ban tip ya ka status ka joti ka kot ki ka joti te kata ki di kam ka bangi ai ki nalot yang kita susu ka bangi ai service ki client kalau bangi yo ru bangi siong bania slok bat ki ka bangi ong ki focus discussion group FGD ka bangi siong bat ki client da kata ka bangi yo ban kren bat ki kalau bangi la ma ku ki kan ya counseling ni ha ban ai ki sai ki khana kumnu ha bidi bat ka bakin jadai lagi, nak penyang timpang bakin nam spread, bakin light nak di spread yang penyang HIV, nang ta kita dulu, bakin light nak di timpang hepatitis, Hep B, Hep C, bat kuih, and then nang ta kita susu kini ki IEC material kabangi cat I kena like pamphlets kabangi ngamut pano, nang kita ki yo pandem bangkit nak kita pun ki kena ki sungop hang di tip happy, ke ika baki kin sya ngop dan ke bakin sya penjot hak jingim ke jeki ke balang leng baki jingepit gitu ki jingpang sistem dan tak ada kini ke ki kamram ki bang ni dan nalon tas isu dan ki peer educator ke bangi ni hapan pet sefit ni hapan monitor kum ki outreach ni hapan lech langbat ki client lu bat ki peer educator ke jengi nam bilaban itu ni nam bilaban recheck tu ki brief ki ba penentang ni akan di rocks ke jadi nang ba itu lembak kini ki peer educator ki jengi lapan identify jadi nang ta sisu idon kini ki bangi ai service ki client kalau bangi ai ya katakan RMC regular medical check up jadi lain nata idon sekiu ki bapun ba ki kam nanda batai kai cerong ha dengan ai tang kini tang kata hai
Saat kami kerja kelima pak, kumno pipinya day ni ate bat kibreu, ban penbiang ni kerja non kam jomki.
Kerja day, bangi pennya day bat ki, kini kena ke bangi ni try, kimut ya kata.
Kumno pipinya day ni ate bat ki.
Bat kita kena ke bangi ya try ni. Okay. Toh kerja day kerja ni bangin bat kini kena. Amar bunsin hi yo imo hakai mang kasalang ke sini yakin ki kena ki wala mo hakini ki dingdi sniu mo kumpi drugs hakai mang salang ki sai kinur ba ki sai ben ha tenna kata kata kim dam na chu ban lai sinu sinuru kim don den tisu te na kata kata da ka jinyo ka janga bangan yo ban trei hang ni po organization na smuku ba ta long ka wi ne ka benta ka ba ngang ya rap yaki kini kena bunsin ngala pro kai experience ka bangala ha ka jinsiam ka bangatri leng bakan ka kamu yo iba nakiya serum chenen ki sa iben ko mangala nang tala da ki yo yang ki posam ki ka jin posam ki ke joki kalong ba ki I don dikarna tena kata kadaw ko mangala maneng la patay ki service ka bangi niya yo I hantu ken ba kini kena don kena ki basya ki basya skor ni ba ni yo ro banwan ra ki sa ka bagi ki yo bandi dawai pada ke jinyo ke joki bandi dawai dei ka penlong ki pakin kelaru ke jingim kata kadi kala ka bangila pan penyedai ki te nasnu thu ru ba ngintri kini kikam nala pan phai ke jingim ka ba ya dei ba ke jingim ba kan jablai ki jingim kristan ke jini ni thu thu ba nin ha pan yarap lem ki namar ladangi kloi ban yarap iki hiru kin yok musim te namar kata ngasngo ban ong ban khot lang ru leng ba kanika la kai jing sim ju pi ban interview na khot na we lang ye ki we ru ba ni don na ka jong ka benta la ni jok di ru ke jongi ban ni yarap lem ki namar ladangi ngim yarap mangi manupat pan yarap ladangi sedang menta lado pan in sedang ni yo ibu kum ka cai ban riu ke jongi ha kai lang ka salang ke jongi lada ki bapun ki cha te ha te ladang ngim yarap mangi benta kan sapoi ka por baro ki khna sana ki ta cha te cha kum ni phai chi ki state ki jala kum cha po Punjab ni babun ki pila cha te set slung mamut banong ki cha te nama balik ki ai la shoot na yin na sem bat ka poi ka benta ka baki ong pan yong kurim so ban yong kurim ki hapan tes nama kidan ki babun ki baki ki kan dipang kum ki ATBH na tak tahu ni don kam hatas ti pe jengiru te kum mapi na kaliang jong ka student jong ka sedi de mano as khot na we lang ni sim ya ka ni yarap ka ti ka diam komon pat pin ilami tu ki khna la da pin yundu ha rum haneng hayo ha pin ilami kiru khna ma ki kin yo pan kala de tam mangi pin si kani ata yi bangin in ya de ye ki in yarap mangi kanam la da ni me trilang kum kai nang ka sama tai
Can you share your experience working with clients struggling with addiction or mental health issues?
Alright. So first thing, we understand that addiction is a disease. So when we understand that it's a disease, the way we deal with the person is different. It's a process. It's not a one-time thing. You know, the clients don't just come here and sit for a session with me, and you know, I can't just expect them to change. It's a process. It's a journey that I have to go through with them, and I don't expect them, you know, to always be to have a perfect journey. They might face, you know, they might go through relapse, and about that I would always encourage my clients that, you know, relapse is not really a problem for me, but the main problem would be if they do not come back here after relapsing.
So the next question that I want to ask is what counseling approaches or modalities do you find most effective?
Alright. So the main approach would be, for me, I usually go with the client-centered approach because I believe that each individual knows him or himself the best. Right? So I cannot tell you to go a certain way, do certain things, and I cannot expect you to change. Nobody can change anybody. I'm here to support, I'm here to guide, and through that approach, you know, with time, I believe that change is going to come.
So the last question would be, how do you assess clients' needs and develop treatment plans?
So the first thing is clients come here, and you know, the registration process would be I take the intake. That would include their history, overall history, and you know, knowing their history and their dose of drug intake. Then from there we consult the doctor, and with their consent, if they're willing to, you know, go through the OST, you know, or the therapy, then we start. So it's not just something that I do alone. We have to consult with the doctor.
Thank you very much.
Thank you. Thank you.
Boleh semua tak aku pun di kepada kau masuk buat di pendidik saya lah dia.
Keteng jong ada naik bon maruny, ngah ada UST lain hanya VHAM, bat upor ngah volunteer tu kumu pia jepita.
Di ki kamram jongpi kumu pia educator hakadi ke organisation.
Kamram ni jong kumu pia educator, kadai mostly kadai ban lecture field. Tengi lecture field ngah ban kendo iki lain. te andang ilai kendu ki klan ni haban bel rapo bat ki kan ni haban ya keren ya kana ya penju untuk lang dinang tu pedang ni sakli ya ki jing dan kam ki jangki ya ki lang hari ni ai ki provide ki services ki jangi kembali ai ki syringe kini new syringe bagi lumno ik tu ki use syringe te nang ta ding ya keren ki ni batai ki sepang kini ki jingpang rukan kum ki HIV kum ki STI ni ai ki pamphlet ki baya dai bikini ki HIV ki STI ki hepatitis C but ni provide ye ki services kum condom ni ai ki condom ni batai ki sepang single use jong syringe kum juru ni shat hi kai ki kum no bakin care kan bakin baka khnang baka behavior jong kiam kan change ne behavioral change ke bandan kan long naga jinglong jong ki men chwa kum to ni persang ye ki bakin ban lam ye ki ban wan di dawai shakani ka shakani ka organization ni shakanu ka organization ka ba baki ki sno jan kan nang bakin lak kan nakani ka jingidi kan te ka ba pada ni shat ya kentu ye ki bakin le testing maka testing ru kalong very important ye ki namar ba kumenta khnang bungin da ban keep track kenya kene ka jing sprang jong HIV da namar mata ka HIV ki kio bha bat ka kiru among the IDUs te kata ki ni shet persang ki bangin pinchlo ki bakin lebe ka testing bat ni shat ya yurute kinu ki baladi diu ban test ni motivate ki bakin test kan tingi motivate ru ki bakin kalana ru kata ko wai tingi shat dalam ru di counselor untuk specially counseling te sa kawai ru ni ini ni ai men sem ki kan namar ba kiru te bi bangi ri bedi ba ki shat share te hangi te ni shat ya ling bat ki lada dan kinu ki ba dan HIV ni hepatitis ni ling ki shapo ki ai shapo civil hospital ye
Coba kumdo pi penyedai bat penet ya kejinya dai jong pi bat ki baya trilang bat ki bapi aji kaya ke
kumno ma penet te pema ba fnlang hi pe educator fi de bandan ke qualities te kum finang de banang kren tien ka thliet fi ha banang open minded fi ha banang ru sensitive te fem de ba fnlang chukran pathar kran kol ma te ha banyanang man penyedai bat ki namar balai ni dan kam yaki kiru ki dan kam yani ma ting ni hapia long teli ke ngaru amla ban kran ke ban long offensive ki ni ha ban long very sensitive te lada namar balai ni tet ba ngaru de budi ngaw ngasno thu te yu te kata kin long habang ibel ko to karapo to ka first jual first face to long itu ti kadan no ka jingedai shani ayanga ngaru haban shani ayu tienda ladan ko to ka shani am dang ngayang ni nyalitas la tre te dang one show office su one pen de ladang ngim nang hi ba kitim ka thliat ngim nang hi ngim de hi bri basung thu am kiu kinisi yeng ite tang
Kerteng jua di dari Sukharkran ngatrai po VHAM as a staff nurse.
Kekerteng jonga de iban lam nang tiring do ngatrai hani VHAM kum staff nurse.
What are the types of medicines that you give to your clients?
We have only one type. Kalau tangi sejak bitiu dawai kerteng udah buprenorphine. We done 2 mg but 0.4. Long tang ajat bet bagi ai di 0.4 but 2 mg tang kita bet ni.
What is your roles and responsibilities?
Role and responsibility jangi lingkong ni ai counseling yaki clients nangta kari regular medical check up man laga lai banai sisin lai banai ben bat ka ICTC sisin ru banai hi hab alam test bejeki civil hospital bat ka hepatitis C hepatitis B ru ngile testing hani
Kamram jung di long hab ai dawai ikum tu ting ai counseling ki ai ki advice ni ki idea ikum tu ki clients itu ting wan gini banang long khana tu long ni ting ai advice ki idea ki ikum tu bakim de ban pep ikum tu ki de long regular ikum tu de ki kwa bakin long lat ikum tu kan ma ting ki don kam ting si ong ki don kam ka jing support na yeng ikum tu additional murder don kam ka jing support na yeng ikum tu em long maki ruki long kaper te yaki nomor ting ting gidon bati yang manitu hayang ikut tu te kim kwa manitu ban pentip hayang nomor ki amba pen berapa kum taja kum ta kum ta ikut tu temo te long kawai ba kong san mo gidon kami ka jing tip na yeng jing support na yeng im tu ting ting nomor gidon ka support nomor kim la biang te ting ting support ka pang stom nomor ada kim tu hayang ting ting la support dawai ikut tu at least ki tip na yeng pan at least kila yo on pension na yeng nomor ting ting si ong dan ki pang stom tu dam la at least kila ban wan na yeng ikut tu ti ban wan pension wan ikut tu long man ya ka bab ki yo ban du dawai te at least ki tip na yeng pat ki yo ban wan pension na yeng ikut tu kan kata ya.
To know more about this agency, you can check the link in the description or can contact the number given below.